I'm board certified dermatologist Steve Dave Louie, here to talk to you today about intralesional triamcinolone injection in the treatment of hidradenitis suppurativa, or HS. So intralesional triamcinolone injection is something we've done for a long time to help calm down flares in HS. This was one of the first studies that looked at, does it actually work? And they used a concentration of 10 milligrams per milliliter, and they used different amounts based on the size of the lesions. And as you can see, from day 0, when the injection was performed, to day 1 and 2, there were significant improvements in pain, redness, and suppuration. So this kind of matched what we already knew from our clinical experience, that it can help calm down inflammation. But the studies that really changed my practice came more recently, where they used higher concentrations at 40 milligrams per cc to inject nodules, abscesses, and tunnels. And you can see there was resolution of 80% of nodules, 70% of abscesses, and over 50% of tunnels. So this really caught my attention when even tunnels were able to go away, because usually I used to say they needed surgery, like de-roofing or excision. For nodules, you go right into the middle of the inflammation. For abscesses and tunnels, you don't want the steroid to just leak out. So you want to avoid getting it into the cavity. So you either go around and under it, or kind of maneuver around it to get it under there. The dose that I typically use is between 0.25 to 1 cc per lesion. We aren't really sure the maximum dose that you can use in one session, but I'm willing to use up to 2 or 3 cc's, because when we're using it intralesionally, very little gets systemically absorbed, and it really stays in the tissue where we want it to have its action. Here is a video of the procedure that's pretty simple. So this patient came in for a flared up abscess, and I could feel that it was fluctuant. You can see we cleanse with alcohol in the typical fashion, and then go sort of next to the lesion and angle under it to get the steroid underneath the lesion. Patients sometimes have a little discomfort just because of that extra pressure, but I let them know over the next 2 days, it's going to get a lot better. If you find you're injecting and the steroid starts leaking out of one of the openings from the tunnel or from the abscess, you can simply push deeper to penetrate your needle through the floor of the lesion and then continue injecting under the lesion, or you can come out and kind of go in at a different spot. So I hope this will change your practice as much as it has changed mine. Any patient who comes in for a flared lesion and wants injection, I don't bother with lower doses. I use the highest concentration of 40 milligrams per cc in the hopes that the lesion won't come back. Sometimes you get partial improvement, so it may take 2 or 3. Usually after 3 injections, if we're not seeing significant improvement, I start talking about surgery. Thanks so much.